Hello everybody, my name is Ronnie Punangbayan and this is my assistant MJ, and we are going to perform a ankle taping for inversion ankle sprain, and then we're going to go through some exercises for rehabilitation. Okay, so now MJ is holding the camera for us, so important that we keep her ankle in a 90-degree 0 degrees of dorsiflexion, so her ankle is in neutral here. And since the injury was an inversion, if you relax your foot here, inversion ankle sprain, that means that her ankle rolled inward like this. So we want to keep that as far away from that as possible, which is be here in neutral position, okay? So we're going to start by applying some pre-wrap to her ankle here. I would usually put some sort of adhesive that help we want to wrap about here towards where the gastroc tendon begins. So the tendon is where the muscle ends, and the tendon comes down here towards the heel. I notice that we have a little window back here, so I'm just going to go back around and try to cover that window, because when the tape is adhered, you want it just to go on just the pre-wrap. Oh, kind of messed up there. That's okay. Usually if there was some sort of adhesive, this would not be a problem right there. All right. Then we're going to take our tape. And we're going to start by making some anchor points. Those are going to start right here. I'm going to come around. And I'm going to do most of the strips going from this, starting at the midline and coming around, pulling medially. This is to prepare me for later on when I get down to the ankle. Most of my turns are going to be going from medial to lateral to prevent unwanted inversion of the foot. So we're going to put another anchor down here on the metatarsals. I'm going to try to get it as smooth as possible. So what I was talking about earlier, about going medial to lateral, we're going to create some stirrups here. So you want to start at your anchor point. And usually I'll go right over that medial malleolus and attach to the other side, attach to your lateral anchor. And then I kind of smooth it down to conform with the foot. Sometimes the patient or athlete may get tired, so you may want to either put this across your chest so that they remain in dorsiflexion, but I think my assistant is able to maintain that. And so after you do the first stirrup, what you want to do is you want to make some horseshoes now. So you're going to attach here to this bottom anchor. And you're going to come around. We're going to again do this medial to lateral over and around. And we're going to create this basket weave effect by creating another stirrup here. You want to go halfway across the tape so that it sticks to something. Coming around. Attaching to that other anchor point. And try to conform it down towards the foot again. We're going to do another horseshoe slightly superior to the previous one. There we go. It's okay if they cross a little bit. It's a little wrinkled, but it'll do. And then one more here. So that's 3 stirrups in total. And these horseshoes, or some people call them spurs, that's also 3. All right. Now, after that, we're going to create a heel lock. So it's going to start up here, a little bit above the tailor joint, and you're going to come underneath the medial malleolus, right here on the heel. And it's going to come behind the lateral malleolus and end up here in the front, kind of where you started. And you're going to do one more for the other side to lock in the other. You're going to go down across tailor joint, underneath the Achilles, behind the medial malleolus, and come across the tailor joint again. I should keep that in place. And then from there, you just want to cover up a lot of your windows there. Your pre-wrap should be covered. Oh, so you do that one. That's not a good piece. And then you're done. How's it feel?
Good.
Good. All right. And then you can press pause. Okay, so now we're going to go through some rehabilitation exercises after the inversion ankle sprain. MJ still has her foot wrap, so we're going to use her other ankle to kind of demonstrate. So first exercise I want you to do, MJ, is I want you to, well, first of all, do you know your ABCs?
Yes.
Okay, good. So first of all, I want you to spell out or draw the ABCs with your foot.
A, B,
Nice, perfect. C,
C,
perfect, cool. So the ankle ABCs are to regain ankle active range of motion after the sprain. So sometimes you would have difficulty moving in certain directions. Most likely it would be coming out into eversion because you would have injured the anterior talofibular ligament most likely, or the calcaneofibular ligament, or the posterior talofibular ligament. Those might be injured, so if you were to go into inversion, those might create a little pinch. But we want you to kind of go through these motions as pain-free as possible, or with as minimal pain as possible. And I want you to do this. I want you to go 2 sets of ABCs 2 to 3 times a day. Okay? And the second exercise that I would have you do, I have this fitness band here, but you could, in fact, use a towel or belt or something like that. So what I want you to do here is I want you to pull back on the band while trying to keep your knee straight and bring back your foot into as much dorsiflexion as you can. And then you should feel a stretch right down here through your gastrocnemius. Do you feel the stretch there?
Mm-hmm.
Good. So I want you to hold this exercise, this stretch, for 30 seconds, then take a break, and then do 30 seconds again. I want you to do that about 2 to 3 times a day as well. And so that would usually be tight because, again, we know the mechanism of injury, most likely for inversion sprains, would be plantar flexion and inversion like this. So that means that your foot or your ankle would want to stay in that position to kind of not be any painful. This is the painful position for you here now. So you want to stay in this position, which would shorten the gastrocnemius back here. So over time, if you were staying in this position to avoid pain, the gastroc would get tight. So that's why we want you to stretch that out, because if you didn't, you might end up lacking ankle dorsiflexion, which would make you prone to chronic ankle sprains. Okay. So that is my taping job. Let's show them the tape job here. This is our ankle tape job, which is wrinkled. And these are the exercises for the inversion ankle sprain. All right. Thank you very much.